Have you ever bumped into a door frame and just, laughed it off as being clumsy? Or maybe you needed your phone's flashlight to read a menu and thought, well, I guess this is it. I'm getting older. We all do it. But what if those little moments aren't so little? What if they're actually your body trying to send you a really important message? So let's get into it and figure out how to tell the difference between normal aging and a serious red flag for something like glaucoma. This quote right here, it just hits the nail on the head. For most people, serious vision loss doesn't show up with some big dramatic flash. No, it kind of sneaks in. It starts with these tiny little shifts that are so easy to just brush aside. And that's really the challenge we're talking about today, learning to hear those quiet whispers before they turn into a roar. And that leads us right into what I call the just getting older trap. It's this mental shortcut we all take, right? A new ache, forgetting where you put your keys, a little change in your vision. We just file it away under the aging category and keep moving. But when we do that, we could be throwing out some really valuable data about our health. I mean, seriously, think about it for a second. The author of the article we're looking at talks about smacking their shoulder into a doorframe for the third time in 1 week and just joking about it. It's so relatable. But every single one of those bumps, that was a clue. It was a sign that their brain wasn't getting the full picture, especially from the edges of their vision. Okay, so here's the million-dollar question. How in the world do we separate the harmless stuff from a critical warning sign? Let's break down the key differences between what's totally normal for aging eyes and what should make you think, maybe I should get this checked out. So on the left, you've got normal aging. This is the stuff we all expect, like needing reading glasses because the lens in your eye isn't as flexible anymore, or, needing more light to read. The key words here are gradual and symmetrical. It happens to both eyes, slowly over a bunch of years. But the stuff on the right? That's a whole different story. Gaps in your side vision, one eye suddenly feeling off, any kind of rapid, lopsided change, those are the red flags. And that's because glaucoma is often called the quiet thief of sight. It works by damaging the optic nerve. That's the super important data cable that connects your eye to your brain. And here's the sneaky part. Your brain is so amazing at filling in the blanks that you can lose up to 40% of your vision before you even realize anything is wrong. By the time you notice it, the damage is already done. So, to stop that from happening, we need a better tool. Let's walk through a super simple 7-point checklist that'll help you spot the symptoms that really do need your attention. And this brings us right back to that first and probably most common red flag. Needing more light in a dim restaurant? That's normal. But constantly bumping into things, missing that last step on the stairs, or being surprised by someone who walks up right next to you, that's not about the light. That's about your field of vision actually shrinking. It means your brain isn't getting all the data from the sides. This quote, wow, it's just so powerful, isn't it? This is basically red flag number 4 in action. A pattern of bumps and trips and near misses. Your bruised chins, that little dent in your car door, that coffee you spilled because you didn't quite see the edge of the table. That's your body's early warning system just screaming that your spatial awareness is off. A few other big ones to keep on your radar are things like suddenly seeing halos around lights, or maybe that weird feeling when you cover one eye and realize the other one just isn't pulling its weight. The two big takeaways here are asymmetry. Is this happening in just one eye? And speed. Did this change happen over a few weeks instead of a few years? If the answer is yes, you gotta pay attention. Okay, I need everyone to pause for a second and really look at this slide. This is not a call your doctor on Monday kind of thing. This specific mix, severe eye pain, a headache, feeling nauseous, and seeing halos, can be a sign of something called acute angle closure glaucoma. This is a true medical emergency, and you need to get help immediately to prevent permanent vision loss. Seriously, do not wait. All right, let's shift gears from just spotting problems to actually taking action. We're going to move away from that vague, anxious feeling and get a clear, simple score that tells you exactly what to do next. Think of it as your own personal risk assessment. Just take a quick look at this chart. It's a really simple point system. You get 2 points if you're over 60 or if a direct family member has glaucoma. Those are the heavy hitters. Then you get 1 point for other things, like being between 40 and 59, having certain ancestries, or conditions like diabetes. Just take a second right now and add up your score. And here it is, the clear call to action. If you scored 4 or more points, or, and this is important, if you've noticed any of those 7 red flags we just talked about, this is your signal. It's time to book a comprehensive eye exam. And I don't mean someday, I mean in the next few weeks. So, you've got your score, you know the signs, now what? Let's turn all that information into action with a really concrete, totally manageable plan to take control of your eye health. It really is this simple. Number 1, take another look at those red flags. Number 2, know your personal risk score. And number 3, pick up the phone and make the call. That's it. You can go from feeling worried to taking action in less than 15 minutes. It's really just about deciding to make your future sight a priority. And if you do make that call, what actually happens? I promise it's not as scary as it might sound. They'll check the pressure in your eye, take a good look at your optic nerve, and probably do a visual field test. That's the one where you click a button when you see little flashes of light. They might also do a scan called an OCT, which is pretty much a high-res photo of the back of your eye. These are all common, easy tests. Just remember, the biggest risk isn't the exam, it's putting it off. So let's end with this question. Today we focused a lot on vision, but the bigger lesson here is about listening. It's about treating those small, easy-to-dismiss changes not as annoyances, but as actual data. So ask yourself, what is one small thing your body is trying to tell you right now? And what are you going to do about it?